Sometimes you don't realize how much you're missing until you hear it again. A conversation across the dinner table, the television without constantly turning up the volume, someone calling your name from another room. Hearing changes can happen gradually, which is exactly why many people adjust to them before realizing how much they're affecting everyday life. So if you've started wondering, maybe I should get my hearing checked, where do you begin? Welcome to Review Remedy by ScoreDoc, where we turn healthcare research into practical information you can actually use. Today, we're looking at 3 best audiology clinics in and around Hagerstown, Maryland in 2026. We'll introduce the 3 practices featured on ScoreDoc's list and give you a practical guide to choosing an audiology provider, preparing for a hearing evaluation, and knowing what questions to ask.
Let's start with something important. A hearing problem isn't necessarily just about getting hearing aids. Audiology can involve evaluating hearing, identifying the type and degree of hearing loss, discussing hearing-related concerns, and determining what options may be appropriate. Sometimes the issue is related to age. Sometimes it's prolonged noise exposure. Sometimes hearing changes can be associated with ear conditions, medications, or other health factors. And sometimes what feels like hearing loss may actually be something else. That's why getting evaluated is more useful than trying to diagnose yourself from a volume button.
Our first featured practice is Audiology Services, LLC. It's one of the providers featured on ScoreDoc's 2026 list for the Hagerstown area. If you're considering an audiology clinic, one of the first things to ask is, what does your hearing evaluation include? A proper evaluation can provide much more useful information than simply asking whether you can hear a sound. You may want to understand whether the assessment looks at different frequencies, both ears, speech understanding, and other factors relevant to your symptoms. And if hearing loss is identified, ask the provider to explain the results in plain language. You should leave understanding what was found and what it means.
The second provider on today's list is Freedom Hearing Center, LLC. And here's something people sometimes overlook. Tell the audiologist what you're actually struggling with. Don't simply say, "My hearing isn't great." Explain the situations where you notice the problem. Maybe restaurants are difficult. Maybe you're constantly asking people to repeat themselves. Maybe phone conversations are challenging. Maybe you hear someone speaking but can't clearly understand the words. Those details can help your provider understand how hearing difficulties are affecting your daily life, not just what happens during a test.
Our third featured provider is the Feldman Hearing Studio. If you're researching hearing care, another important question is, what happens after the evaluation? If hearing loss is identified, ask what options are available. Depending on the individual situation, that could involve hearing technology, communication strategies, monitoring, or referral for additional medical evaluation. And if hearing aids are recommended, don't be afraid to ask about the practical details. How are they fitted? How are they adjusted? What follow-up is included? What happens if they're uncomfortable or aren't helping enough? Understanding the aftercare can be just as important as understanding the initial recommendation. The Hearing Care Checklist.
So you've got 3 clinics to research. Here's a simple checklist you can use when comparing them. Number 1. What kind of evaluation do they provide? Understand what the appointment includes and what you'll learn from it. Number 2. Who will perform the evaluation? Ask about the audiologist's qualifications and experience relevant to your needs. Number 3. What happens if hearing loss is found? Understand your options rather than assuming one solution fits everyone. Number 4. Is follow-up included? Hearing technology and hearing-related care can require adjustments over time. Number 5. What will it cost? Ask about evaluation fees, devices, follow-up appointments, repairs, and insurance or other coverage. And number 6. What happens if the problem may be medical? Certain hearing or ear symptoms may require evaluation by a physician or an ear, nose, and throat specialist rather than being handled solely as a hearing device issue.
There's also a very practical way to prepare for your appointment. Bring someone with you if you can. Not because you can't manage the appointment yourself, but because 2 sets of ears can sometimes catch details that one person misses. Also, bring your medication list and any relevant medical history. And think about when you have the most difficulty hearing. Is it at home? In restaurants? At work? On the phone? With multiple people talking? In noisy environments? Write those situations down. Your goal isn't to arrive with a diagnosis. Your goal is to give the audiologist a realistic picture of your everyday experience.
And here's something worth remembering. Hearing loss doesn't have to be dramatic before it's worth discussing. If you've noticed gradual changes, repeatedly asking people to speak louder, increasing the television volume, struggling in conversations, or having difficulty hearing in noisy environments, a professional evaluation can help you understand what's happening. And certain symptoms deserve medical attention rather than simply assuming they're ordinary hearing loss. For example, sudden hearing loss, especially in one ear, should be treated as a medical concern and evaluated promptly. If hearing changes happen suddenly or are accompanied by severe dizziness, neurological symptoms, significant pain, or other concerning symptoms, seek appropriate medical care rather than waiting for a routine hearing appointment.
Another point that often gets missed: good hearing care isn't only about hearing more, it's about communicating better. If hearing difficulties are making conversations frustrating, affecting relationships, or causing you to withdraw from social situations, tell your provider. Those real-world effects matter. And if hearing technology is recommended, give yourself time to adapt. Ask questions, return for adjustments when needed, and tell the provider honestly if something isn't working.
So, if you're in Hagerstown or the surrounding area, today's ScoreDoc list gives you 3 places to begin your research: Audiology Services, LLC, Freedom Hearing Center, LLC, and the Feldman Hearing Studio. Use the list as your starting point, then compare the things that matter to you: services, evaluation process, qualifications, location, follow-up, and cost.
We've included the complete ScoreDoc guide in today's show notes, so you can explore all 3 featured providers. Because hearing care isn't simply about making the world louder. It's about making communication easier, staying connected, and understanding what's happening with your hearing before a small problem becomes a bigger barrier. Thanks for joining us for another episode of Review Remedy. Until next time, don't normalize a change just because it happened gradually. If your hearing is affecting your life, ask questions, get evaluated, and find care that helps you stay connected.